Okay, I have 1:15 straight up, so we will go ahead and get going. Welcome everybody to our weekly media briefing regarding all things in the COVID-19 pandemic with the City of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will begin with opening comments, first of all, from Mayor John Hamilton.
Thanks a lot, Chuck. Good to be with you all. Just a quick updates on city data. We had another one positive case among our employees, so that's a relatively low number, but we still want to get to zero this week. I have no new reports from CBU on data this week. I can say we actually went up 4 percentage points in the number of our employees who have reported their full vaccine status as fully vaccinated to us. So that's a 4 percentage point bump up to 68%. Just in 1 week. We're pleased to have that, maybe reflecting the health enrollment beginning, which has the $600 wellness rebate for folks next year. So I can report on that. We're glad to see that. As folks know, our overall numbers locally, state, national are improving. The basic numbers, I know we'll hear more about that in terms of hospitalizations, deaths, positivity, et cetera. That's good. It's steady improvement we've seen over a number of weeks now. It's still slow. It's not as dramatic as we'd like, but I want to note appreciation to the Board of Health locally for their continued focus on the data and the infection levels and the recommendation to continue the protections locally here, and welcome the commissioner's support for that, I hope, next week to keep those in place until we get to the benchmark numbers. We know those protections are important. They're saving lives. And I'll just conclude by noting that we just passed the millionth positive case in the state in the last week or so, just as a benchmark. That's a sobering number that 1 million Hoosiers have tested positive locally in the state. And just noting, we still have 20 Hoosiers a day dying of this disease and 1,500 around the country dying of COVID after we have very effective vaccines that can protect us. So it is really important to keep moving ahead with those steps that we know help with vaccinations, including for younger folks that may be available soon, as well as the boosters that are available to some, as well as masking and the other protocols. So we are making steady progress, but there are still serious daily costs and remind us the importance of continuing our efforts. And I'll hand it back to you, and happy to take questions, Chuck.
Okay, let's check in with the Monroe County Health Department and Penny Caudill.
Good afternoon, everyone. So this week there has been a lot of buzz around vaccines, so I want to start there. The CDC's Advisory Committee on Immunization Practices did review the US FDA's amended emergency use authorization vaccine for booster doses. And remember that a booster dose is another dose of the vaccine that's given to someone who has already built up protection after the vaccination, but that protection is decreased over time. So we refer to that as waning immunity. The CDC has issued booster eligibility guidance, and based on those recommendations, the Indiana Department of Health has put out their support for those recommendations and guidelines. So for individuals who received a Pfizer or Moderna vaccine, the following groups are eligible for a booster shot after 6 months or more after their initial series. So they were fully vaccinated after they received those first 2 vaccines. And now after 6 months, they could get a booster dose if they are 65 years or older, if they are age 18 and older who live in long-term care facilities, if they are 18 and older with underlying health conditions. And those medical conditions can be found at the CDC's website. There's a list that explains each of those. And age 18 or older for those who work or live in high-risk settings. Booster doses are also recommended for anyone 18 or older who got a single dose of the Johnson & Johnson vaccine. And they just need to wait 2 months after they've received that initial dose. So eligible individuals may choose to get the same vaccine that they got originally, but if it is not available, and mixing and matching, as they've referred to it, is allowed. So if you go into a facility and you originally had Moderna and they've run out of Moderna, but they have Pfizer, that booster dose could be a Pfizer vaccine for you. Please use ourshot.in.gov to schedule an appointment to find places that are available for you. If you don't have access, you can call 211 for that assistance. And as you know, the state, when you go onto Our Shot, there is a registration system, and that will be ready to go for these boosters. It should be ready on Sunday. So if you go in today, and I know we've already started getting people calling about those booster shots, if you go in today, you won't necessarily be able to schedule it for Moderna or for Johnson & Johnson, but after Sunday, you should be able to do that. Currently, we have just under 61% of our eligible population that is fully vaccinated. And we have a high demand right now for vaccine, but that is really being driven by booster doses. So those booster doses are important. We want to encourage people to get them, but I will tell you that our first priority is to get those who have not been fully vaccinated. So that's our top priority, but nobody is going to be turned away from getting their vaccine if they are eligible for it. There's also lots of talk about Pfizer and children 5 to 11 years old. So the FDA VRBPAC committee, and that is a subcommittee, they will review data on the 5 to 11-year-old vaccine, the Pfizer vaccine, on October 26th. And following that, the CDC's ACIP committee will meet on November 2nd and 3rd. So we anticipate getting some more information after those meetings. So could be as early as November 3rd or 4th or 5th, we'll hear what the approvals are, what the next steps are. And of course, once the CDC gives those directions, then we're going to wait for local state direction and what we need to do and how we'll move forward. I will tell you that the state and the local health departments are all very busy making our plans for how we are going to get those vaccines out and make them available. Our initial plans will be currently how we've been doing it. So offering school clinics so that we can make it easy for parents to get their children vaccinated without them having to take off work. They can also visit their child's healthcare provider for that vaccine or local pharmacy. And once we get those things done, then if it looks like we still have a lot of interest and we've missed people, then we can set up some short-term, larger mass type clinics to fill in and make sure that everybody has had an ample opportunity to get those vaccinations. The good news in our school clinics is that while we didn't have a big uptake on the COVID vaccines, the flu vaccines have been very popular. So we're very pleased that people are taking advantage of flu vaccine in the school age population. And we encourage everyone to get your flu vaccine, get it early so that you've got that 2 weeks to build up immunity, and we can just keep as many people out of the hospital system as possible. Our current status, Monroe County does remain in yellow advisory. We have 111 cases per 100,000 people this week, and that is a high level of community transmission. We talk about that every week. Our positivity rate was 4.46%. So with that, the Board of Health met last night to review the data and look at our regulation, that our current regulations set to expire on the 31st, or when we met our goal of less than 50 cases per 100,000 and we're in a blue advisory. So we're not going to meet that goal yet. So the board reviewed the information, they heard public comment, and they did decide to move forward because we still have substantially or high community spread. So we will be moving that forward. The Board of Commissioners will have to approve that recommendation to extend the current health regulation. And as you all know, and I think probably everybody on this call is aware, that the state updates that advisory once a week. They update it every Wednesday. And so once we meet that goal, it will be announced on a Wednesday, and midnight that night is when the current health order is set to expire. So we've got to meet that goal. Once we get there, midnight of that Wednesday, it will expire. And the only other thing that would cause that to expire would be if the board decided to rescind it early, or if when they meet in October on the 18th or November 18th, if they meet at that time and decide to extend it because we haven't met that goal, for example, then they could extend it, and it would have to again be approved by the commissioners. So that is the status. And by making it midnight, that will give us time. Once we hit that mark, we'll be able to get that information out through press release, and all of you who are on this call sharing information with us will be able to help us get that information out to people. In terms of testing availability, certainly we have the Gravity site, a community site that's at Profile Parkway, and that is normally open Tuesday through Saturday from 8 to 4. And I have mentioned in the past few meetings that the Indianapolis Motor Speedway has testing and vaccine available through the end of this month. So that is through October 30th. They are also open, I believe, Tuesday through Saturday, but it is noon to 8 p.m. So one thing that I do want to make note of just today, Gravity Diagnostics did notify us that they did have to close the site today. And that was a combination of the weather, specifically the wind and the cooler temperatures, and the heating mechanisms that they had for staff, because this is an outside clinic, are not functioning today. So they did have to send folks home. So I wanted to make people aware of that. But typically when that is open on, again, Tuesday through Saturday, they should be open tomorrow, hopefully. You do not need an appointment. It is a show up and be seen facility. They are still working to move inside, and they're hoping that that will happen very soon, but we do not have an estimated date for that move indoors. So they did want to send their apologies for any inconvenience that caused. We wanted to share that information with you today. And coronavirus.in.gov is where you can find a list of all of your testing options. And finally, I just want to remind you that as we come into the holiday season, we can have safe holidays, get vaccinated, follow recommendations and regulations. We shared last week some safe holiday practices for Halloween. And also remember your pet's safety at Halloween. The Board of Animal Health has put out some guidelines for your pets as well. So I encourage you to visit the Board of Animal Health's guidelines. We can have a safer, more normal holiday if we continue to take precautions and remember that the virus is still circulating. So please get vaccinated today.
Okay, would next go to the Monroe County Commissioners. I'm not sure that I see our representative on the call or not. Speak up if I'm missing you. So I don't think that we do have someone here. So we'll go ahead and go to IU Health and Shauna Gerges today.
Hi, Chuck. Great to be with you today. I'm happy to share that in the last few weeks, we have started to see a steeper decline in our COVID-19 inpatients across the region. We are seeing a similar trend here in Monroe County between IU Health Bloomington and Monroe Hospital. As Brian has shared in the last few weeks, last year's flu season was very minimal in terms of people needing hospitalization, which we can attribute to the safety measures people were following, including wearing masks, but around individuals who don't live in the same home, social distancing, and increased hand hygiene. Please continue to do your part in these practices, and most importantly, get your flu vaccine this year, and hopefully we'll have a safer and healthier holiday season. As you can see on the screen, our numbers of inpatients hospitalized due to COVID-19 are overwhelmingly the unvaccinated. And even those who are vaccinated tend to have less severe reactions to the virus. This truth has never changed. Vaccinations save us from severe illness and save lives. The New York Times recently published data from 40 US states showing that only 0.2 of 1% to a high of 6% of COVID-19 deaths occurred in fully vaccinated people. Those individuals have comorbidities, meaning they already have chronic diseases and sickness that prevents their bodies from fighting the repercussions of the illness. Additionally, the New York Times reported that the CDC has found 85% of the fully vaccinated individuals who have died from COVID-19 were 65 years or older. Another recent study compiled data from the CDC, the US Department of Health and Human Services, and the US Census Bureau, which found that Indiana had the 11th highest overall death rate in the country. In the same study, Indiana was 45th in vaccination rates, the 6th worst vaccinations in our country. The state is also 41st in total positive cases. The information on these studies is placed in the chat so you can review the data and these important statistics. We can do better at protecting each other and demonstrating how we care for our fellow neighbors and our community. We know the vaccine works. We know the vaccine is safe, and we know that it can save lives. If you have questions about the vaccine or would like to talk to someone about scheduling your vaccination, please reach out to our community health team at 812-353-3244. Again, that's 812-353-3244. You can also reach out to the Monroe County Health Department, who we've heard from today, and most importantly, your primary healthcare provider. I'm happy to take questions at the end.
Okay, let's next check in with Indiana University. We'll go to first Dr. Aaron Carroll, who will hand to Kirk White.
Thank you very much. Things have been going very well on our campuses. The dashboard was updated today. Last week on basically all of IU Bloomington's campuses, there were 25 cases. 19 of them were in students, 6 of them were in faculty and staff. That's one of the best weeks we've had. And it might get lower, but I don't know how much lower it might get. I mean, that's 2 to 3 cases a day. We're seeing similar trends across all of our campuses where this was probably our best week of the semester, and it's looking like next week is already shaping up to be pretty good. We're not seeing anything that's concerning in terms of transmission. Still, almost all of our transmissions seem to be either household contact or small group gatherings. Nothing to be concerned about with respect to any official IU capacity or really transmissions at school. And when we do have close contacts and they are vaccinated and we test them before 3 to 5 days, but now 5 to 7 days, according to CDC protocols, we're just seeing very little transmission among the vaccinated population, all of which is good. With widening booster recommendations, we are encouraging our faculty and staff and students who are appropriate to talk to their healthcare providers and get boosters, but we're not making any major changes to policy at this time. Clearly, we are knowledgeable about the extended mask mandate. We see no changes internally as long as that is going on. And so we're continuing to watch and be concerned with what is going on with respect to COVID, but we're pleased with how things are going on campus.
Well, thank you, Dr. Carroll. That's a great report. And just also to recap our vaccination rates, there's more good news there. We went up 0.5% this past week from 93.2% vaccinated last week to 93.7% this week. So continuing a good trend there. And I'll also build on the discussion that our others have had about the flu vaccine, influenza vaccine. It's important. You don't want to get both COVID and flu too. So let's be sure to get our flu vaccines. And along those lines, IU Bloomington campus will have its third clinic this Sunday from 12 to 6. and that will be at Simon Scott Assembly Hall. It's a quick, easy 10-minute in and out. I did it at the last clinic. We already have 2,000 reservations for Sunday, but we've got capacity for 3,000. So I'd encourage you to come on by. You can make an appointment if you like, but we can take drop-ins too. There's more information here I put in the chat. We look forward to seeing you there at the Vax Clinic, and both Dr. Carroll and I'll be ready to answer any questions.
Okay, we do have our first question from Dave Askins, and that's for Mayor Hamilton. Can you elaborate on the $600 wellness initiative or incentive? Did I hear that right, that there's now $600 available for those city employees who have been vaccinated? For those who've received the $100 incentive already, do they receive the $600 for a total of $700? How long has it been available? And given the apparent positive result, why wasn't this implemented sooner? Was this part of a new window of open enrollment for employee insurance?
Yes, thanks. Yes, the $600 is a wellness incentive for those employees who are under our healthcare plan. So it's part of the 2022 open enrollment process, which just opened this week. And the employees who are covered under the health plan receive a $600 wellness rebate above and beyond the $100 wellness rebate, which was available to all employees regardless of their health care coverage choices or status. So apparently it appears that this benefit, the wellness benefit for next year, is moving our numbers a little bit. So I'm glad we did it, and encourage all to look at that kind of thing. We'll keep you posted on those numbers as they go. That was just this week's report. I hope that answered the question.
So waiting for other questions here. Penny, while we're waiting, I want to come back to you. Can you again speak to the mask requirement discussion and again reiterate how that process will work and where we are in that right now?
Certainly. So our current regulation that does require masks in all indoor public spaces, so retail food, retail business, public office. There are some exceptions that are written into the order. The current order is set to expire on the 31st. Last night, the Board of Health met and approved extending that order. And they did not put a specific date. They just linked it to the goal that we have in the current health order. So that change, the extension to that order, will go before the commissioners next Wednesday. And we anticipate that they will approve that and extend it. So what that means is the current order and the next order has set a goal that we will remove the mask requirement once we are no longer in a high or substantial level of community spread, so that our cases per 100,000 have fallen below 50. So if we're at 40 per 100,000 and we are in a blue advisory, then the health order would be rescinded automatically. And that will occur at midnight on the Wednesday that it is posted. So, sometimes that gets posted as early as noon, sometimes it's 5 p.m. So the board voted to make that midnight so that there's kind of a hard time that it expires once we reach that goal. Does that make it more clear, or am I still?
Yeah, I think so. Mayor Hamilton, you want to add something?
Chuck, yes. No, thank you, Penny, for that. This is just back to the other question I realized as I reread it. The $600 wellness incentive, just to be precise, is actually paid out per pay period over the 2022 payroll year. So you're deducted from your health insurance copay, your payroll deduction and for your health insurance is reduced for a total of $600 in every paycheck during the 2022 year as a wellness incentive. That's just how it applied, not in one lump sum. Thanks.
Okay. Seeing no other questions, I'll hang on a moment here and give everybody an opportunity to ask another question if you have one. Again, I'll put in the plug for my shop. covid.iu.edu is where you can find all the information about Indiana University's COVID response. The latest dashboard that Kirk mentioned is up to is it 92.7 this week? Is that right? From
93.7.
93.7. I knew that I was getting that wrong. So again, vaccination rate going up. It can't go down, as Aaron likes to say. So we are continuing to do very well in that regard. But this and when a new day would come through. So we do have another question for Penny Caudill. The trigger at the end of the mandate is being in a blue advisory, talking about the mask requirement. That requires the numbers to be low enough for 2 weeks in a row, correct?
That is correct. And I would add on to that, remember that we can be in a blue advisory and still have our cases be above 50. So we have to meet both of those things. So we have to have less than 50 cases per 100,000 and be in a blue advisory. So yes, if we hit our metrics to be blue, technically next week, we would still be yellow next week. And it would be the following week that we would turn blue.
Okay. So another question here. What are the metrics for the blue advisory? This one coming from Emily Brown.
That can be found on the state's website. So it's a combination of the positivity rate and the cases per 100,000.
Okay. So give just a moment here again for more questions. If you do have them, we'll hang on and give you an opportunity. So again, we'll be back next week at noon and answer more questions if you have them then.
At 1:15.
At 1:15. Did I say 1 again?
You said
I
noon.
come on here at 1. Just a little inside baseball. So.
Anyway.
Not that anyone cares, but just to let you know. Okay, seeing no other questions, I think we will leave it there and give you back your time. Appreciate the questions today, and we'll see you next time.
Thank you.
Thanks, everyone.